You know that moment when someone's talking to you, your grandchild, your spouse, a friend, and you just miss it? Not because you weren't paying attention, you were, but somehow the words just didn't quite land, and you smiled and nodded anyway, hoping nobody noticed. Most people chalk that up to daydreaming, or distraction, or just getting older. But what if I told you that moment, that specific feeling, is actually one of the earliest warning signs of hearing loss that millions of people miss every single year? I'm Dr. Anthony, and today we're going to talk about something that affects 1 in 3 adults over the age of 65, and yet the average person waits nearly 10 years before they ever get it checked out. 10 years. That's a decade of missed conversations, misunderstood moments, and quiet frustration that most people just quietly absorb and never talk about. Today I want to change that. We're going to walk through 5 warning signs of hearing loss that people almost universally mistake for something else entirely: tuning out, aging, stress, or just not being focused. And I want you to watch all the way through, because the 5th one especially catches almost everyone off guard. It's the one I see most often dismissed, and it may be the most important. Let's start with what's actually happening inside your ears, because once you understand the mechanics, everything else makes a lot more sense. Inside your inner ear, there's a tiny, incredibly delicate structure called the cochlea. It's coiled like a snail shell, and it's lined with thousands of microscopic hair cells, little sensory receptors whose only job is to detect sound vibrations and send them to your brain as electrical signals. Now, these hair cells are remarkable, but they have one major flaw. Once they're damaged or destroyed, they don't grow back. Not in humans. That's not something that happens. The Journal of the American Medical Association published research back in 2019, confirming what audiologists have suspected for a long time, that age-related hearing loss, which they call presbycusis, is primarily caused by the gradual degeneration of these cochlear hair cells, combined with changes in the nerves that carry sound signals to the brain. It's a slow process. It doesn't happen overnight. And that's exactly why it's so easy to miss. Because your brain is extraordinarily good at compensating. It fills in gaps. It predicts. It uses context. And for a while, sometimes a very long while, you won't even notice the loss is happening, because your brain is quietly working overtime to cover it up. But there are signs, 5 very specific signs that your auditory system is struggling, even when your brain is doing its best to hide it. And the first one is probably happening to you right now. The first warning sign is struggling to follow conversations in noisy places, and assuming the problem is the noise, not your hearing. Picture this. You're at a family dinner. Everyone's talking, there's silverware clinking, maybe some music playing in the background, and you find yourself just lost. Not because you're not trying. You're trying harder than anyone at the table, but the voices around you are blurring together. You keep asking people to repeat themselves. You start to strategically position yourself near the one person you can actually understand. And afterward, you feel exhausted in a way that's hard to explain. That exhaustion has a name. Researchers at the University of California, San Francisco published a study in 2021 in the journal Ear and Hearing, and they found that people with early hearing loss expend significantly more cognitive energy, what they called listening effort, in complex sound environments. The brain is working so hard to decode speech that it pulls resources from other cognitive functions, including memory and attention. That's why after a loud dinner or a noisy gathering, you might feel mentally drained even if you sat still the whole time. Now here's what makes this warning sign so deceptive. Most people don't think, I might have hearing loss. They think, that restaurant was too loud, or everyone was talking over each other, or I've just never been great at following group conversations. They externalize it, they blame the environment, and honestly, that's a completely natural thing to do, because the environment does make it harder. But for people with normal hearing, a noisy room is an inconvenience. For someone with early hearing loss, it becomes genuinely overwhelming. The specific reason for this comes down to something called high-frequency hearing loss. This is the most common pattern of age-related hearing loss, and it's particularly sneaky, because low-frequency sounds, bass tones, background noise, the rumble of a crowd, are often preserved. What gets lost first are the high frequencies, which is where most of the consonants in speech live. Sounds like S, F, TH, SH. These are the sounds that help you distinguish words from one another. Without them, speech starts to sound muffled. People seem to be mumbling even when they're not. The National Institute on Deafness and Other Communication Disorders, which is part of the NIH, has noted in multiple publications that this pattern of high-frequency loss is present in approximately 50% of adults over 75, and begins to show measurable changes in many people starting in their late 40s and 50s. So if you're sitting there thinking this is years away from being relevant to you, it may already be relevant to you. The second warning sign is turning up the TV volume without realizing you've done it, or having family members comment on it. This one tends to come up in a very specific way in conversations I have with patients. Someone will come in for something entirely unrelated, and at some point they'll mention almost as an afterthought, "Oh, my wife keeps telling me the TV is too loud," or "My kid said something about the volume when they visited," and they'll shrug it off. Because to them, the TV doesn't sound loud at all. It sounds fine, normal, maybe even a little quiet. And that right there, that gap between what you're hearing and what others around you are hearing, is one of the clearest, most consistent early indicators of hearing decline. Research published in the International Journal of Audiology in 2018 looked at a large sample of adults across multiple age groups and found that self-reported TV volume preferences were significantly correlated with audiometric test results, meaning the louder someone needed the TV to feel comfortable, the more likely they were to have measurable hearing loss, even if they hadn't been diagnosed. The interesting thing is, most of these individuals did not believe they had a hearing problem when surveyed. They simply thought they liked the TV at that volume. This is the brain's compensation at work again. When your hair cells stop sending strong enough signals, your brain adjusts its internal calibration. What used to feel loud starts to feel normal, and so you creep the volume up, not dramatically, not all at once, but gradually over months and years, and at no single point does it feel like a dramatic change. It just feels like preference. There's also a phenomenon that audiologists have documented called the recruitment effect, which sounds counterintuitive but is actually very common in people with sensory neural hearing loss. Certain sounds are very hard to hear at normal volumes, but then at higher volumes, they suddenly feel uncomfortably loud. So someone might struggle to hear conversation at normal levels, but then find that if someone raises their voice past a certain point, it feels almost painfully sharp. The range between too quiet and too loud gets much narrower. A 2020 paper in the journal Trends in Hearing described this effect in detail and noted that it often makes people feel like they're caught in an impossible situation. They need more volume to understand speech, but higher volume can become uncomfortable. That's not a quirk or a preference. That's an auditory system under stress. So if your family has commented on the TV volume, even once, I want you to take that seriously. Not because they're being critical of you, but because they're observing something from the outside that is genuinely hard to see from the inside. The third warning sign, and this one surprises almost everyone, is frequently mishearing words rather than missing them entirely. Here's what I mean. Most people assume that hearing loss means you simply don't hear things. Silence, absence. And yes, in advanced stages that can happen. But in the early and middle stages of age-related hearing loss, what's far more common is that you hear something, but you hear it wrong. You think someone said park when they said dark. You think someone asked for vine when they said wine. You answer a question that wasn't the question that was asked, and everyone looks a little confused, and you feel embarrassed without quite knowing why. Or you're watching a movie and you think a character said one thing, but the subtitles say something different. A landmark study published in the journal PLOS One in 2016, conducted by researchers at the University of Maryland, looked at speech perception errors in older adults with and without diagnosed hearing loss, and found that mishearing, perceiving the wrong word rather than perceiving silence, was actually more common than complete non-perception in early-stage hearing loss cases. The brain fills in what it expects to hear, and what it expects isn't always what was actually said. This is related to a concept in auditory neuroscience called top-down processing. Your brain doesn't just passively receive sound, it actively predicts and completes it based on context, memory, and expectation. When the incoming signal is degraded, when those high-frequency consonants are getting lost, the brain does its best to reconstruct the word. And sometimes it gets it right. But sometimes it confidently reconstructs the wrong word entirely, and you have no idea it happened. This is why people with early hearing loss sometimes come across as inattentive or confused. Their family might say things like, "I feel like you're never really listening," or "You always answer the wrong question," and the person with hearing loss is genuinely confused by that feedback, because from their perspective, they heard something, they responded, they participated. What they don't know is that what they heard and what was said were two different things. The Hearing Loss Association of America published guidance noting that this specific pattern, hearing without accurately understanding, is one of the most psychologically difficult aspects of early hearing loss because it creates a persistent, low-grade sense of social confusion that people often can't name or explain. They just feel slightly out of step in conversations, slightly behind. And over time, without understanding why, some people begin to withdraw from social situations because those situations feel subtly exhausting and disorienting. Which brings me to something I want to address directly, because it matters enormously. Untreated hearing loss doesn't just affect your ears. Research from Johns Hopkins University, a series of studies led by their Department of Otolaryngology, Head and Neck Surgery, published between 2011 and 2019, found a significant and consistent association between untreated hearing loss and cognitive decline, including an accelerated risk of dementia. The researchers proposed several possible mechanisms: the increased cognitive load of effortful listening, the social isolation that often accompanies hearing difficulty, and the possibility that whatever is causing the hearing loss may also be affecting broader brain structures. I want to be very clear here. Hearing loss does not cause dementia. That's not what the research says. But untreated hearing loss appears to be a modifiable risk factor, meaning it's one of the factors that, when addressed, may reduce risk. The World Health Organization included hearing loss on their updated list of potentially modifiable dementia risk factors in 2020. That's significant, and it's one of the most compelling reasons to take these warning signs seriously. Let's talk about the fourth warning sign, which is tinnitus, that ringing, buzzing, or hissing in the ears, and the very common mistake of treating it as unrelated to hearing loss. Most people who have tinnitus know they have it. It's hard to ignore a persistent sound in your head that nobody else can hear. But what most people don't know is that tinnitus and hearing loss are deeply connected, often two expressions of the same underlying damage. Tinnitus affects approximately 15% of the general population, according to the American Tinnitus Association, but that number rises significantly with age. Among adults over 65, some estimates put it closer to 30%, and in a large-scale survey published in the American Journal of Medicine in 2014, researchers found that roughly 80% of people with tinnitus also had some degree of measurable hearing loss, even when the individuals themselves reported no hearing problems. The mechanism is thought to involve those same cochlear hair cells we talked about at the beginning. When they're damaged or dying, they can send erratic, spontaneous signals to the brain, random noise that the brain then tries to interpret as sound. That's the ringing, the buzzing, the hissing. It's not sound from the outside world. It's your auditory system misfiring. Now, tinnitus alone doesn't always mean you have significant hearing loss. Some people have mild tinnitus with minimal hearing decline, and the two don't always progress at the same rate. But what the research does strongly suggest, including a 2017 review in the journal Frontiers in Neuroscience, is that new-onset tinnitus, especially when it appears in people over 50, should be treated as a potential signal that the auditory system is under stress. Not panic-worthy, but definitely worth getting evaluated. And yet, what I hear from patients and what surveys consistently confirm is that most people with tinnitus have never spoken to a doctor about it. They've been living with it for years. They've adapted. They turn on a fan at night to cover it up. They've told themselves it's just stress or blood pressure or something they ate. And maybe sometimes those things do play a role. But if you've had that sound in your ears for more than a few months, especially if it's constant or getting louder, that's a conversation worth having. There are also specific patterns of tinnitus that are more closely associated with hearing loss than others. High-pitched tinnitus, a ringing or whistling above the range of normal conversation, tends to correlate more strongly with high-frequency hearing damage than low-pitched sounds. A study in the journal Otology and Neurotology in 2019 found that the pitch of a person's tinnitus often corresponded directly to the frequency range where their hearing loss was most pronounced. Essentially, the brain was generating phantom sound in the frequency range where real sound was being lost. That's a remarkable finding when you think about it. Your brain is literally trying to fill the silence. And now the fifth warning sign, the one I promised at the beginning, the one that almost nobody connects to their hearing. This one is about social withdrawal, increased anxiety in group settings, and what many older adults describe simply as feeling more tired after spending time with other people. Let me describe a pattern I've seen play out over and over again. Someone who used to be socially engaged, who enjoyed dinner parties, church groups, family gatherings, starts to slowly, quietly pull back. They start making excuses. They're tired. They're not feeling well. It's too far to drive. The place is always so loud. Gradually, the circle gets smaller. They spend more time at home. And if you ask them, they might say they've just become more introverted as they've gotten older, or that they prefer the peace and quiet. And sometimes that's true. Preferences change with age. But sometimes, often, What's actually happening is a slow, unconscious retreat from situations that have become genuinely difficult. Because when you can't follow a conversation easily, when every social interaction requires intense concentration and still results in confusion and misunderstanding, socializing stops being enjoyable. It becomes work. Hard, tiring, sometimes humiliating work. And people avoid things that feel that way. A major longitudinal study published in the Journals of Gerontology in 2016 followed over 1,000 older adults across several years and found that individuals with untreated hearing loss were significantly more likely to report social isolation, and that this isolation preceded, not followed, significant declines in physical and mental health. The social withdrawal was an early sign, not a consequence, an early warning. The connection to anxiety is particularly important. The American Psychological Association has noted that hearing difficulty in social settings closely mirrors some of the behavioral presentations of social anxiety: avoidance of group situations, preference for one-on-one or quiet environments, heightened fatigue after social interaction. And this creates a tragic confusion in a lot of older adults. They start to believe there's something wrong with their mind or their mood, when actually the root of the problem is in their auditory system. Research published in the journal Depression and Anxiety in 2018 found that older adults with untreated hearing loss had significantly elevated rates of depression and anxiety compared to peers with either normal hearing or treated hearing loss. The treated part of that finding is crucial because it suggests that addressing the hearing loss can actually reduce the psychological burden, not just the auditory one. I want to sit with that for a moment because I think it's one of the most important things I'll say today. Treating your hearing isn't just about hearing better, it's about protecting your mental health, your relationships, your sense of connection to the world around you. These are not trivial things. These are the things that determine quality of life in the years ahead. Now let's talk about what you can actually do, because a list of warning signs without a clear path forward isn't really helpful. The first and most important step is getting a hearing evaluation. Not a screening on your phone, not the test your GP runs with a whispered voice in a hallway. A proper audiological evaluation performed by a licensed audiologist using calibrated equipment in a sound-treated environment. This is what generates an audiogram, a detailed map of your hearing across multiple frequencies, and it's the only reliable way to know what's actually going on. The American Speech-Language Hearing Association recommends that adults over 50 get a baseline hearing evaluation even in the absence of symptoms, because early-stage hearing loss is frequently subclinical, meaning it doesn't feel like anything yet, but the damage is already underway. Knowing where you're starting from gives you a reference point for the future. Now, let's talk about hearing aids, because I know this is where a lot of people's defenses go up. There's still a significant stigma attached to hearing aids, particularly among the current generation of 65 to 80-year-olds. A 2020 survey conducted by the Hearing Industries Association found that while approximately 40 million Americans have clinically significant hearing loss, fewer than 20% of them use hearing aids, and one of the primary reasons given was stigma, not wanting to appear old, not wanting to call attention to a disability. I understand that, I genuinely do, and I want to offer a different frame. Hearing aids today are not what they were 20 or 30 years ago. They are extraordinary pieces of technology. The smallest ones are virtually invisible inside the ear canal. Many are Bluetooth-enabled, streaming audio directly from your phone or television. Some can distinguish background noise from speech in real time. A 2021 review in the journal Trends in Amplification described the current generation of hearing aids as representing a generational leap in both performance and discrete design, compared to devices from even a decade ago. More importantly, the evidence for their benefit is substantial. The Achieve study, a large randomized controlled trial published in The Lancet in 2023, found that hearing intervention, including the provision of hearing aids, reduced the rate of cognitive decline in older adults with hearing loss who were at higher risk for dementia. That was a significant, peer-reviewed finding in one of the most respected journals in medicine. Treating hearing loss may literally protect your brain. There are also newer options that have expanded access dramatically. Over-the-counter hearing aids became available in the United States in 2022 after the FDA cleared a new category for adults with mild to moderate hearing loss. These devices are available without a prescription at pharmacies and electronics retailers for a fraction of the cost of traditional hearing aids. They're not appropriate for everyone. Severe hearing loss or complex auditory needs still require professional fitting, but for many people, they represent a real and accessible entry point. Beyond hearing aids, there are several evidence-based strategies that can protect the hearing you have right now. Reducing noise exposure is the most important one. Loud noise, anything above about 85 decibels sustained over time, accelerates hair cell damage. That includes loud concerts, power tools, lawn equipment, and yes, earbuds and headphones at high volumes. The World Health Organization estimates that over 1 billion young people worldwide are at risk of hearing loss from recreational noise exposure. Among older adults, cumulative lifetime noise exposure is one of the primary contributors to age-related hearing loss, on top of the natural aging process. The protective strategy here is simple: earplugs when around loud machinery, and the 60-60 rule for personal listening devices, no more than 60% of maximum volume for no more than 60 minutes at a time. Cardiovascular health also plays a direct role in hearing. The cochlea, that inner ear structure we talked about, is richly supplied with blood vessels, and it's extremely sensitive to reduced blood flow. Research published in the American Journal of Audiology in 2017 found that conditions like hypertension, diabetes, and high cholesterol were associated with accelerated hearing decline, likely because of their impact on the small blood vessels supplying the inner ear. Keeping your blood pressure, blood sugar, and cholesterol well managed is genuinely hearing protective. It's not just about your heart. There's also emerging and preliminary research on the role of certain nutrients in hearing health, particularly omega-3 fatty acids, magnesium, and vitamins C and E as antioxidants. A study published in the American Journal of Clinical Nutrition in 2010, a large prospective cohort study following over 65,000 women, found that higher dietary intake of long-chain omega-3 fatty acids was associated with a significantly lower risk of hearing loss. I want to be careful here because this is not the same as saying a supplement will treat or reverse hearing loss. It won't. But there's enough early evidence in this area that maintaining a diet rich in these nutrients, think fatty fish, leafy greens, nuts and seeds, is unlikely to hurt and may contribute to overall auditory health. Finally, and this applies whether or not you've noticed any of today's warning signs, please don't underestimate the importance of talking about this with your doctor. I know that sounds basic, but hearing loss remains dramatically underdiagnosed, and a big part of the reason is that people don't bring it up. They're embarrassed. They assume it's just aging. They don't want to start down a road that ends in a device in their ear. But your doctor cannot help you with something they don't know about. And the earlier hearing loss is identified and addressed, the more options you have, the more you can preserve, the more you can protect, not just your hearing, but your cognition, your mood, your social life, your independence. Here's what I want you to take away from today. If you regularly struggle to follow conversations in noisy places and you've been blaming the noise, that's worth getting checked. If your family has commented on your TV volume, even casually, even once, that's worth getting checked. If you frequently mishear words, if people seem to be mumbling, if you answer the wrong question more than occasionally, that's worth getting checked. If you have ringing or buzzing in your ears that's been going on for months or years, that's worth getting checked. And if you've been quietly pulling back from social situations and telling yourself you've just become more of a homebody, please consider whether something else might be going on, and whether getting checked might be the place to start. Any one of these signs by itself might not mean much, but 2 or 3 of them together, or even one that's been going on for a while, is a reason to make an appointment. If you found something in today's conversation that felt familiar, something that made you think of yourself, or of someone you love, I'd really encourage you to share this video with them. Not as a way of saying, I think you have a problem, but as a way of saying, I care about you enough to share this. Because so often, the people who need this information most are the last ones to seek it out. And if you have questions about anything we covered today, leave them in the comments below. I read them, I respond when I can, and the questions you ask often shape the topics I cover next, so your voice genuinely matters here. If this is your first time here, I'd love for you to subscribe. We cover topics in aging, cognition, cardiovascular health, and evidence-based wellness, always grounded in real research, always translated into plain language, always aimed at helping you live your best years ahead. Because getting older doesn't have to mean getting quieter, and the conversations that matter most with the people you love about the life you're still building are worth protecting. Take care of yourselves. I'll see you in the next one.